When we're looking at patients with single limb stance abnormalities like Trendelenburg and valgus collapse, one of the things that we want to take a look at is going to be the hip abduction coordination test. This allows us to look at the strength and flexibility of the hip in the frontal plane in an open kinematic chain. And so we're going to ask the patient to lie on their side. The bottom knee is slightly bent just to give them a little bit of support. We want to make sure that the pelvis is stacked right up. As a matter of fact, sometimes when I treat patients with exercises like this, I'll have them lay with their back against a wall so it keeps them in straight alignment. We're then going to ask the patient to raise their leg about 30-40 degrees up off of the table while trying to keep the pelvis level. Now when we take a look at this, if a patient has weakness of the gluteus medius that's associated with a Trendelenburg or some of the other findings that we're seeing, we might notice that they rotate their hip outward as they raise it up. This would be a finding consistent with a patient who's got issues with piriformis, tight piriformis or something like that. We may also find that the leg drifts forward into flexion and rotates out. That would be a position more consistent with the psoas. Another set would be as they raise the leg up, it kind of drifts backward. And in that case, we're suspecting more of a tight IT band or tensor fascia lata as being the major factor that the patient has an issue with. This is also a great place to look at rotational core stability as well, because if the patient has a poor balance of coordination between the obliques and the quadratus lumborum, you may find that their pelvis rolls backward or forward, making it more challenging for them to keep themselves in position for this particular test.